please keep in mind these factors are only chances. So you can take well care of you, because many of us never give it a second thought to our health. Breast cancer is a malignant tumor, a collection of cancer cells arising from the cells of the breast. But from where does breast cancer come from? There are many factors. The first is age. The chances of breast cancer increases as one gets older. The second is family history. The risk of this cancer is higher among women who have relatives with the disease. Having a close relatives with the disease, like a sister, mother, daughter, doubles a woman's risk. The third is personal history. Having been diagnosed with the breast cancer in one breast increases the risk of cancer in the other breast, or the chances of additional cancer in the original breast. The fourth is women diagnosed with certain favorable non-cancer breast conditions have an increased risk of breast cancer. These include a condition in which there is an abnormal proliferation of breast cells but no cancer has developed. The fifth is menstruation. Women who started their menstrual cycle at the younger age, before 12, or went through menopause later after 55 have a slightly increased risk. The sixth is breast tissue. Women with dense breast tissue, as documented by mammogram, have a high risk of breast cancer. The next is exposure to previous chest radiation also increases the risk. Next is being overweight or obese increases the risk both in pre- and post-menopausal women. Use of oral contraceptives in the last 10 years increases the risk of this cancer slightly. Using combined hormone therapy after menopause increases the risk of this cancer. The next is alcohol. Alcohol increases the risk of breast cancer, and this seems to be proportional to the amount of alcohol used. A recent study reviewing the research on alcohol use and breast cancer concluded that all levels of alcohol use are associated with the increased risk of breast cancer. This includes even light drinking. The next is genetic risk factors. The most common causes are mutation in genes. Inheriting a muted gene from a parent means that one has a significantly higher risk of developing breast cancer. The last is body piercing. Body piercing in the nipple area increases the risk of breast infections, which leads to breast cancer, and these may be particularly difficult to treat. The next is, what are the symptoms of breast cancer? The first is a lump or mass in breast or underarm area. If a breast is injured by trauma, tiny blood vessels can rupture to cause an area of localized bleeding that can be felt as a lump. The injury can also form a lump in the breast. While most breast lumps are harmless, benign, every breast lump should be evaluated by a doctor to exclude or establish a diagnosis of cancer. Chances that a particular breast lump could be cancerous depends on many factors, including past medical history, physical examination, as well as genetic and other risk factors. There are many causes of breast lumps. Some of these causes are harmless, while others can be painful or dangerous. Causes of breast lumps include infection, injuries, non-cancerous growths, and cancer. Most common sign or symptom is a swelling apart or inflammation. But most inflammations or rashes on the breast are not due to the cancer. They may be caused by benign problems or fungal infection, especially swelling a part of the breast. The next is nipple discharge or redness. There are two types of discharges. The first is if the discharge occurs without being touched, can be caused by benign, non-cancerous growth. Second is the discharge can also be caused by the cancer of the breast tissue. Because discharge can be an important sign of cancer, it needs to be evaluated by a doctor rather than self-worry about a cancer. The next is changes in breast skin texture, such as puckering or dimpling like an orange skin, and skin changes on the breast including redness and warmth can sometimes be a sign of cancer. A manual examination of breast is an important screening method for detecting cancer, and it's the first step in the evaluation of breast lump. Unfortunately, the manual examination of breast is not precise, so don't worry until you evaluate it by doctor. Breastfeeding for 1.5 to 2 years lower the risk of breast cancer. Exercise also reduces the risk of breast cancer. One of the important thing is breast cancer frequently causes no pain in the breast. Although women often worry about breast pain, most women with breast pain do not have breast cancer. It is not a typical symptom. Thank you. Thank you so much.